Thank you so much for the introduction. I'm Christy. I'm a current medical student at UIC, and today I'll be talking on the prevalence and association of psoriasis with seborrheic dermatitis. So seborrheic dermatitis is a chronic inflammatory skin condition that is associated with these yellow, greasy scales, and it commonly affects seborrheic areas, which include the scalp, head, neck, as well as the body fold regions. And it's fairly common. Our research that'll be presented this week actually suggests that this prevalence is probably around 4 to 5% globally, which is higher than what was previously estimated at around 1 to 3% in the adult population. It's also known to be higher in certain population groups, such as HIV/AIDS, as well as Parkinson's, and the clinical picture, as well as the distribution of the skin findings, may overlap with psoriasis. In fact, common clinical teaching, as well as anecdotal reports from literature, suggest that there is a frequent coexistence between these two conditions. So as you can see in the top, middle, and right photos, you can see that thick yellow scaling with erythema. SIBO psoriasis is known to be more of an overlapping versus transitional state. It has these deeper red, more defined margins, and that thicker scale. And so the prevalence and association of co-occurring seborrheic dermatitis and psoriasis has not been well characterized in literature. And we had hypothesized that seborrheic dermatitis is uniquely reported without much published literature to, in fact, support frequent co-occurrence with psoriasis. So what we did is we performed a systematic review. We did electronic searches on these listed databases. We included studies with at least 20 SD participants that were healthcare diagnosed. And then we also excluded studies that only focused on one body site, as well as special populations and cutaneous reactions to certain triggers. We had at least 2 reviewers independently screen all abstracts, titles, as well as full text, and then we extracted the data, performed bias appraisal using JBI guidelines, and then performed a meta-analysis to find the pooled prevalence as well as the pooled odds ratio. So these are some of the keywords we use in addition to seborrheic dermatitis and psoriasis. And then, so it doesn't look like our data got transferred, but it was a Prisma flow diagram with lots of pretty colors. So as you can see, out of over 2,100 records that were screened, we were only able to include 3. This was very surprising to us. We thought there would be more papers, and most of the papers were excluded because they did not report comorbidity rates. And then these are some of the study characteristics of the 3 papers included. As you can see, there were 2 adult studies as well as 1 infant study. The 2 adult studies had higher sample sizes, and as you can see, the infant population had a higher prevalence relative to the adult population. So using a standard random effects model, we determined the prevalence to be 2.7%, though with high heterogeneity. This was suspected, especially with the inclusion of the infant population. And so using acidic Jonkman method, which optimizes for high interstudy heterogeneity, as well as a small number of included publications, we performed this for the 2 adult data sets and got a prevalence of 2.1%, still with high heterogeneity. We also performed a pooled odds ratio. However, we got an odds ratio of 1.37, which is insignificant. So some of the limitations, we had a low number of published studies that actually examined or reported the comorbidity rates, and then we also excluded certain populations that are associated with higher SD rates, which may lead to an underestimation in this prevalence. And then the infant population was done on patients with infantile seborrheic dermatitis, and then their diagnosis of psoriasis was done at follow-up, which ranged from 2 to 12 years, and therefore may not accurately depict a comorbid state. So in summary, the frequency of coexistent psoriasis in adult seborrheic dermatitis patients is measurable but low at 2.1% and without clear association. Overall, we had very few studies that actually examined the comorbidity rates, and then more prospective studies are needed to characterize psoriasis in individuals with SD for both the general and special populations. And In addition, we should be as specific with our wording as possible as we better understand this relationship between seborrheic dermatitis and psoriasis. And thank you.
Thank you. So any question, audience? So one quick question. Is there any common comorbidities between SD and psoriasis?
Oh, comorbidities. So we didn't specifically look at the comorbidities, but they are known to have higher inflammatory states. One of the papers actually looked at hypertension in seborrheic dermatitis. But yeah.
Okay. Great. Right. Thank you.